In this video, I'll briefly explain the Finnish student healthcare system, how it works, what healthcare services you can use as an international student, and how much do these services actually cost. What's up guys, and welcome back to the channel. If this is the first time we're meeting, my name is Oliver and I'm a master's student in economics at Aalto University in Finland. And on this channel we talk about education and early career development, specifically here in Finland. So if you're new here, do consider subscribing. Before we jump into today's topic, let me thank Hoas for sponsoring this video. Hoas, or the Foundation for Student Housing in the Helsinki region, is one of the largest providers of student accommodation in Helsinki metropolitan area. I've been living in their apartments throughout my studies and I really cannot recommend them enough. Links to apply for their apartments are in the description box below. So, Finnish student health services. How do they work and who can actually use them? To put this in simple terms, in addition to the public, municipal and private health services, Finland has a separate healthcare system specifically meant for university students. The student health services are provided by the Finnish Student Health Services Foundation, or FSHS. As I've mentioned in my previous videos, most student services in Finland are actually provided by non-profit foundations or other organizations founded by local or a national student union. In this regard, student health services are no exception, and FSHS, as it is in its current form, was originally founded in 1954 when the National Union of University Students in Finland expanded those services, which were originally only operating in the capital region, into a national service. So, now that the mandatory history lesson is done, who can actually use these services? The right to use student health services in Finland depends on your student status as well as your student union membership. In short, you are entitled to use FSHS services if you are A. studying for a bachelor's or master's degree at a university or other institution of higher education, B. you are enrolled as an attending student in your respective institution, and C. you have paid your student union membership fee. The same applies to both Finnish nationals as well as international students. As I explained in this video about Finnish student organizations, university students in Finland have to, by law, be members of their university's respective student union. This means that bachelor's and master's level students are automatically entitled to all student health services as long as they are enrolled in the university as attending students. On top, if you are an exchange, free mover or a guest student in Finland, as a part of your international bachelor's or master's degree studies, you are also entitled to all FSHS services as long as you have joined the student union of your respective university. However, important to note that from 2021 onwards, this will no longer be the case for exchange students who will no longer have access to these services even if they have a union membership. Also good to know, while postgraduate students can voluntarily join their respective student unions, they are not entitled to these health services. Alright, so what services does FSHS actually provide? The services offered by FSHS include general healthcare, medical care, mental health care, as well as dental and oral health care. These services do not, however, include hospital care, maternity care, child or family care, or night and weekend duty services. For any of these services, please refer to your local municipal healthcare provider or, if applicable, a private healthcare provider. As with everything else, a full list of health services provided by FSHS can be found on their website, links in the description box below. So, this is all cool, but there is still one more important question to answer. How much do student health services actually cost? Well, basically, the majority of these services are completely free of charge as long as you are enrolled as a student and you have paid your student union membership fee. There are some exceptions for appointments with specialists and dentists whose services are subject to charge. In addition, a fee is also charged for some, but not all, official statements and certificates, and for missed appointments that have not been cancelled or were cancelled less than 24 hours prior to the appointment. So, how much do these specialist and dentist services cost? To give you a couple of examples, as of March 2020, and an appointment with a specialist like a dermatologist or a gynecologist costs 24 euros per appointment, while a dentist's appointment costs at maximum 32 euros depending on the length of the procedures done. Again, I have the full list of services and their fees in the description box below, so go check that out. But yeah, that's basically it. In short, I think it could be said that student health services in Finland are extremely comprehensive while costing little to nothing compared to many other countries. I highly recommend that you guys utilize these services as much as possible while you're enrolled as a student in Finland. For example, during the last 2 years, I've personally especially been using the dental services, and I have to say that I've been nothing short of delighted over the level of service that I've received. Alright, that is it. This was everything for me this time. Hopefully you learned something new about this topic. As mentioned, I have all the links to everything I've been talking about in the description box below, so check those out for more information. If you found this video helpful, do give it a thumbs up and share it with a friend who might have use for this information. And also, if you have anything to ask about this or any other topic related to studying or building your early career in Finland, write them down in the comment section down below and I'll get back to you as soon as possible. Thanks again for watching, guys, and I will see you in the next one. Bye bye.